Ontario's ICUs are under unprecedented stress.
This is the most serious situation we've ever been in, ever, since the beginning of this pandemic.
And officials are preparing people for it to get worse.
It's going the wrong way. We have more and more people hospitalized, more and more people in ICU, more and more people on ventilators.
26 people reported dead today, which is low by recent standards. The pandemic has now claimed more than 4,800 lives in the province.
This morning they were taking someone out. And every time I see that, it makes me cry because it's somebody's loved one that's being taken out on a stretcher.
These sisters are seeing the worst of this pandemic. They help care for their mother, who is living in the middle of an outbreak at our long-term care home. They can't understand how the province is here again.
We were told the second wave was going to be worse than the first. Everyone warned us. This is not news to us.
To save more lives, more hospitals outside of the hotspots are helping out. In the province's southwest, Sarnia has already stepped up. Now this hospital's ICU is at capacity, with half of the patients coming from elsewhere, including nearby Windsor.
The quote lockdown we're facing now, I don't think it's having any impact at all.
The CEO of Windsor Regional Hospital is calling for more restrictions.
Quebec has put into place a curfew, and that's probably something our province needs to look at.
No calls for a curfew today, but the Premier did issue this warning.
There will be further measures because this is getting out of control, and we have to do whatever it takes.
So, Magda, what do we know about when the province is expected to announce further measures?
Well, we heard today that it will be paired with new modeling projections expected next week. But at this point, we already know that things like in-class learning for students, that's being pushed back, and for good reason. We have heard that, when it comes to COVID tests, kids under the age of 13 are now testing positive, 1 in 5 cases, in fact. And the CEO in that story, he says he's seeing that as well. In fact, the youngest person hospitalized with COVID in Windsor is 3 years old, he says. Ian?
Magda Geberselassie in Toronto tonight. Thanks.
You're welcome.
Well, for more on this, let's bring in Dr. Zane Chagla with St. Joseph's Healthcare in Hamilton. And Dr. Chagla, what is going on, particularly in Southern Ontario?
Yeah, so I think there's 3 things. One, it's been 14 days since the initial lockdown. So everything that's happened over the past week, unfortunately, is transmission that occurred prior to lockdown. So we're not seeing those effects yet. Number 2, I think we all understand there were gatherings over the holidays, and that may have led to transmission within households. And number 3, even with these restrictions in mind, there are workplaces that are still having transmission events, regardless of the lockdown, places that need to stay open where, unfortunately, people are still being exposed to COVID-19 and spreading it across their communities.
And you are, of course, seeing patients who are infected, and from that perspective, where are they picking up the infections?
Yeah, it's a bit of all of this. We're seeing people that minimize their symptoms, that congregated to others, that didn't get tested, that spread it amongst households and other gatherings. We're seeing people who get it from workplaces, and again, either get sick themselves or bring it back into their own households or to other vulnerable individuals. And unfortunately, this dynamic between workplaces, indoor gatherings, symptoms, isn't necessarily being addressed with all of this. And unfortunately, we keep seeing transmission from it.
All right. Dr. Chagla, thank you very much.
No problem.